In Brooklyn alone right now, there are 989 people hospitalized with coronavirus. A number of those patients are being treated at the Brooklyn Hospital Center in Fort Greene. That's the hospital where, incidentally, Dr. Tony Fauci was born, the country's top infectious disease expert. That hospital, an independent, historic hospital, is running thin on testing supplies and space and staff who have increasingly started to fall ill themselves. The president and chief executive of the Brooklyn Hospital told the New York Times yesterday, quote, "We are in disaster mode." The hospital's chair of emergency medicine is Dr. Sylvie D'Souza. She told the Times that if the patient volume keeps increasing at its current pace, the emergency room is going to be out of space by next week. The hospital has 18 ICU beds. They quickly filled up. They've added more. As the hospital's own staff have started to fall ill, they have asked for volunteers from New York's Medical Reserve Corps to please come help replenish their ranks. Joining us now live is Dr. Sylvie D'Souza, chair of emergency medicine at Brooklyn Hospital Center. Dr. D'Souza, thank you very much for joining us tonight. I know this is probably the last thing you want to be doing.
Thank you for having me.
Can I just start by asking how you are and how your staff is holding up?
We're holding up. We're doing the best we can, one day at a time.
You're in charge of emergency medicine at one of the hospitals that's really at the epicenter of this crisis. What can you tell me and tell the country about the kind of pace and the kind of increase that you've seen when you started getting your first patients and how rapidly the pace started to accelerate and what the pace is like now in terms of new patients?
Well, we started screening on March 3rd for any patients who would present to the emergency department with influenza-like symptoms in preparation for what was to come. And since then, we've seen and screened approximately 950 patients.
In terms of that kind of, those kinds of numbers and the capacity of your hospital, I know you're in charge of emergency medicine. We've seen some of the data about the intensive care beds, the number of, for example, ventilators. Tell us about the ratio between that kind of influx of patients and what you're capable of managing on a day-to-day basis. How full are you right now?
Right. So this influx of additional patients is in addition to our regular volumes of emergencies that we see on a daily basis. We see approximately 75,000 patients a year. So that comes out to about 200 to 250 patients a day. So these 950 patients are in addition to our regular volume. So you can imagine the challenge. So once we started screening, we quickly realized we needed a mechanism to keep the patients who were the least symptomatic out of the emergency department. And we actually installed a tent 8 days ago outside of the hospital, so to give us the ability to screen those who could possibly be treated at home, and that's what we've been doing for the last 8 days. For those who we recognize as having more severe symptoms, we bring into the emergency department. We had to designate an area. We essentially separated our emergency department into a safe zone, and a zone to evaluate patients who are at risk for coronavirus. We had no other choice in order to protect the other patients who come in with heart attacks and strokes, our regular emergencies, and the staff. So now our zone where we see the patients suspecting as having coronavirus is completely flooded, overwhelmed, understaffed. We're doing the best we can. We essentially, they range from minor symptoms to very critically ill patients who require RCU, who require life support. Many of them remain in the emergency department because we have no space in the ICU to move them up.